Okay, so let's talk about perineal stretching. I think a lot of pregnant women think that the goal of perineal stretching is to just simply like stretch out the tissue so that there's more room for the baby to come out and the less likely they are to tear. But that's actually a really small piece of the puzzle. And so let's first talk about where tearing happens when you have a vaginal birth. So when baby is crowning, so their head is starting to come through, if the tissue does not adapt to that stretch, most likely you're gonna get a tear in the area called your perineum between your vaginal opening and your anus. Now, tearing can happen in other areas, but that is the most common place you will see tearing. So to prevent that, we really wanna do more than just standing there and stretching the tissue. And that is useful. So that's like 25% of the puzzle. So getting that tissue to be a little more stretchy is helpful. But the bigger piece of the puzzle when we're talking about perineal stretching is actually more about training yourself to relax in response to that stretch. So let's think about it this way. If I were to punch you in your arm, right, that's gonna hurt. Your reaction is gonna be to clench up like this. So same thing, when baby's head is crowning, that's a really big stretch to the area, and that can be really painful. So a body's reaction is to tense that area. And if we tense that area, we're kind of like shutting the doors to the baby, when really we wanna be opening the doors to let the baby come out. So the bigger purpose of this perineal stretching is to actually train your body to relax in response to this big stretch. So here's what you're gonna do. You're going to perform your perineal stretching. As you stretch the area, you are gonna start working on some of those nice deep pelvic floor relaxation breaths. So really thinking about finding this full deep inhale, getting a nice 360 expansion, and feeling that drop or release of your pelvic floor. So you're going to apply a stretch, and I will demonstrate. You're gonna apply a stretch. You're gonna take 3 or 4 deep breaths. And once you feel like that stretch is not as intense, or maybe like there is less tension around your finger, you're gonna move on to the next spot. So the goal here is really telling your body and training your body to relax in response to that stretch instead of tighten up. And I think a lot of women wonder like, well, if I have an epidural, am I still going to be able to do this? The answer is yes. That is why we are practicing this for those last 5 weeks of pregnancy, right? So even if you don't have full sensation, you can still breathe into your pelvic floor and find that relaxation. So here's what it's gonna look like, okay? So you're gonna, if you are doing this yourself, you are gonna kind of reach around your belly, insert your thumb about a knuckle deep, and apply a stretch downwards straight towards your anus. Okay, you're gonna apply that stretch. It should feel firm. It shouldn't feel too painful, but it should feel firm. And you're gonna start breathing through it. Once you feel like that stretch has lessened in intensity, you're gonna move off to the other side. So you're kind of making a little bit of a horseshoe, kind of working straight back and then around, and same thing on the other side. Now, if this feels like, how the heck am I gonna get around this big old belly? There are some options. So you can use a tool. This is a pelvic wand, okay? You can use this, insert this really shallow vaginally, and apply that same stretch. You can also have your partner insert their finger, and they can even do 2 fingers, just a knuckle deep, and apply that same pressure. That's a nice option too, because they can give you some good feedback if they felt the muscles relax a little bit. Okay, so keep in mind, perineal stretching is not just about stretching out the tissue. It's really about training your body to relax in response to that stretch.